Welcome to the Aga Khan Hospital Mombasa's Physical Medicine and Rehabilitation Center, a unique building of its kind. This is the only facility which provides an integrative combination of physical, occupational, and speech therapies.
This is the only facility where we'll find niche services like cardiac rehabilitation, neuro rehabilitation, speech therapy, aquatics therapy, and sensory integration.
Here at the PMRC Aquatics Therapy Pool, we're able to manage orthopedic, cardiovascular, and neuromuscular conditions. We'll provide you with top-notch training to bring you improved agility, mobility, stretching, strengthening, and coordination. Come and join us here at the Aquatics Therapy Pool and get aqua fit.
In PMRC Aga Khan Hospital Mombasa, we are providing speech-language therapy services for the adults and children population. For adults, we are providing speech therapy services for patients with communication difficulties as well as with swallowing difficulties. For children as well, we are providing services with communication difficulties, stuttering, voice difficulties, and many more.
We are able to provide top quality occupational therapy services for both pediatric and adult patients. Our services include sensory integration, hand therapy and splinting, activities of daily living training, and we also deal with patients with neurological conditions.
We do neuro rehabilitation for patients with paralysis of upper limbs and lower limbs or one-sided paralysis. These are patients like stroke patients, MS patients, Parkinsonism, and we assess and do a thorough and comprehensive evaluation to make a plan that will befit their physical needs.
For cardiac rehabilitation, we see patients before they have had an event or after they have had an event and they have gone through the cath lab. We do exercises monitoring their blood pressure, their ECG, their heart rate to see how much their heart is performing during the exercise program.
We do spinal mobilization for the neck, back and other joints to ease your pain. So let's all welcome here, take away your pain.
As you can see, we provide a unique combination of therapies. You're welcome to come and join us, work with our top quality physical, occupational, and speech therapists, as well as our physicians attached to the Aga Khan Hospital in Mombasa. With or without a referral, we'll be happy to bring you back to your optimal condition.
For any queries or to book an appointment, kindly call the numbers up here.
Jina langu naitwa Saida Hamid Salim, ni mkazi wa Mwandoni Kisauni huko. Nimekuja hapa baada ya shida moyo, nilianza na pumzi kuniendea mbio. Kaja hapa nikamwona Dr. Swale kwake clinic. Akaniwekea mwanzo echo, akasema niko na valve moja imeziba. Alafu nikaomba msaada kwa kwa NHF, kwa ile kitu ile. Check moyo, akaniambia niko na pipe imeziba. Sasa kabidi tuombe msaada kwa NHF tena mara ya pili. Kwenda kufanya operation Aga Khan Nairobi Hospital. Sasa ndio nimekuja hapa kwa cheki kidogo. After 5 sijaliwa. Naondoka Mombasa kwenda Nairobi kwa ajili hiyo ya kufanya operation katika Nairobi Aga Khan Hospital. Inshallah kwa majaliwa yake Mwenyezi Mungu.
So good morning to all our viewers. Today we have a very, very interesting topic for the day. And today, the topic of the day is World Suicide Prevention Day. That's for me. I will let the professionals talk about it. And we have an excellent panel of specialists with us. I want to give this opportunity to them to introduce themselves, and we'll pick it up from there. So I'll start from my extreme left. Please just tell us your name and your designation and a little bit about yourself.
My name is Wafiyyah. I am a clinical psychologist.
Yep. All right.
Thank you. Good morning, and my name is Hamid. I'm also a clinical psychologist. I'm just joining the camp. I'm happy to be here today. And,
Thank you. Thank you so much.
Yes, good morning, viewers. My name is Dr. Kevin Wamula. I'm a psychiatrist and I work here at Aga Khan. Thank you.
Okay. So, regarding the topic of the day, Salma, what do you have to tell us about suicide?
thank you, Anthony. Actually, September 10th is a very important day, and it is commemorated all over the world. It is the World Suicide Prevention Day, and it is an awareness day, and it is observed to provide commitment and action to prevent suicides, and it's actually various activities are done all over the world. It has happened since 2003, and the International Association for Suicide Prevention collaborated with the World Health Organization and the World Federation for Mental Health to host the World Suicide Prevention Day. Actually, since by 2011, about 40 countries have been taking part in the World Suicide Prevention Day, and Kenya is part of this. Kenya has been taking part. And now Aga Khan Hospital is also taking part in this, which is a great honor that we are taking part to prevent suicide by creating awareness on suicide. Statistics, recently there was a newspaper article that between April and June 2011 in the country, there were about 500 suicides. The youngest person, I think, who committed suicide was 7 years old, and the oldest was in his 70s. This is something of concern. I don't know what other members think. Yeah.
Okay. Very interesting statistic, Salma, and something to note. To our audience, please ask as many questions as possible. We have with us an excellent panel of specialists. To the panel, a very important question that the audience would like to know: why do people commit suicide?
Well, Anthony, I would like to try and answer that. This is Dr. Kevin Wamula. So, basically, people commit suicide for very many reasons. In fact, those experts in suicide, we don't look at suicide as an accident or a disease. We actually look at it as a complication of mental disorders and other medical disorders that ultimately leads someone to take their own lives. In fact, when we look at suicide cases, 90% of suicide cases are due to mental issues. The remaining 10% are due to social issues. So mental issues, there are many diseases, like for instance, depression, substance use disorder, anxiety disorder, and many others. So all those are under the 90%, which are leading someone to commit suicide. The remaining 10%, can be anything from, for instance, we've heard of the suicide bombers due to religious extremists and other aspects for which are socially related. Thank you. I think I can.
Thank you. Our audience, I know we've not introduced the lighter side of our doctors, and I'd like to take this opportunity to ask Dr. Wafiyyah. Dr. Wafiyyah, what are your hobbies?
I love gymming. I love working out.
You love working out?
Yes.
Show us your biceps, please.
I make sure I go to the gym every morning.
Okay.
Yeah, every morning. It's a very important part for me. So I love gymming, I love working out, and I love reading.
All right, thank you. Thank you, Dr. Salma, what are your hobbies, please? It's good for the audience to know.
I spend a lot of time reading, and actually I cook. That's one way in which I distress.
Oh, interesting.
I cook a lot. I cook a lot for the family.
Okay.
And I walk.
All right.
Yeah.
So what time of the day should I come visit you?
You come at about 7:30 once the curfew is over.
Kevin, please tell us a bit more about yourself.
In terms of hobbies, I think mine have been changing over the years. I'm currently trying to pick up mountain biking. I'm trying to go back to swimming. But currently I do mostly movies. So that's where I am in my life. Those are the hobbies I'm into. Thank you.
Good. So, to our panel, can suicide be prevented?
Well, let me answer that question. As I alluded to in the beginning, majority of the cases of suicide are due to mental illnesses. So, by and large, thanks to modern technology and medicine, we can handle many of those conditions. So, yes, in a way, we consider suicide a preventable condition. And yes, it can be prevented to some extent.
Okay. There's so many cases where I know people have threatened to commit suicide. People are worried, it's in their thoughts. What do you do in such a case when someone is threatening suicide?
I think I can take that one. When somebody threatens suicide, I think it's important to take it very seriously. Don't take it lightly. And you can start off by asking direct questions by engaging the person. And for example, asking the person, let's say if they call you, where are you? And how are you coping with what is happening with your life? What are you planning to do? Are you thinking about dying? Are you thinking about hurting yourself? And then make plans to, if you're able to go for them, and urge them to seek professional help. The main thing is that you get hold of them and you urge them to seek professional help. And then if it is a younger person maybe, or any other person, even if it's an older person, encourage them to talk about their feelings and listen to what they have to say. Because when you talk to somebody, the person who is suicidal has somebody to talk to them who really cares for them, who feels that they care. Caring makes a big difference. So the idea is to take it seriously and not to ridicule them, and to get help for them immediately. Find out what they're planning to do and get help for them immediately. Not to joke about it, and not to dare them to do it.
So the key thing is not to dare them to do it, and to be there for them.
Find out what they're planning to do, try and find out what their feelings are, and get help immediately for them. This is a cry for help. It is not something that should be taken lightly.
Okay. Okay. So, what happens to someone who attempts suicide and ends up in hospital? What happens in such a case?
Well, typically, when someone attempts suicide, they are in an acute medical condition. So normally they are received in the emergency area. And what happens is a team of clinicians attempt to save their lives. So depending on what method they attempted to commit suicide, that is what is first addressed, the acute medical condition. Then after that has been addressed, they're now taken to the ward and stabilized. And as they slowly improve, the medical condition improves, then the mental wellness team normally comes in. It doesn't necessarily have to be a psychotherapist. It can be a nurse offering empathetic ear to the person, and that is how the progress, the flow of a patient from attempting suicide into the hospital, from the ER, and eventually going to the hospital. And that's when the mental wellness team. I think it's important to mention that the mental health wellness team, our job is not to report to the police that this person attempted suicide, okay? Ours is to help the individual, so whenever someone attempts to take their life, that is how we are able to assist. I don't know if any of the other panelists would like to add anything.
Is there something you'd like to add in terms of that question? I mean, what happens to someone who attempts suicide and ends up in hospital? I know Dr. Kevin has comprehensively answered it, but maybe the panelist feels there's something maybe you want to add on top of it.
I think he's answered it well.
Yeah, he's answered it very well.
He's answered it very well.
Yeah.
Okay. So, in the current situation, with so much information on the media, in terms of the role that the media has to play, and especially the social media, what role does it have in the cases of suicide that we have here in Kenya?
You know, social media is it's a very powerful platform, I can say, and it allows people to put themselves out there in a way that was not possible before. Mm-hmm. And in that, it can be a good thing, but it can also expose people, make them vulnerable to things like, for example, cyberbullying. Mm-hmm. And cyberbullying, to keep it in simple terms, is repeated and intentional bullying or making fun of another person through an electronic device. So it can be through a phone, it can be through a computer. So you see that repeated and intentional making fun of another person can take a toll on someone. And this can be in the form of threats, can be in the form of mean comments, it can be in the form of rumors that are spread online, and this can take a toll on somebody. It can lead to feelings of just feeling like you have tormented over and over, and that can affect a person. So cyberbullying. There is also the issue of challenges. We've had these challenges that come on. I think there was a challenges to Snapchat, and these challenges, what they do, they groom a person. They give these are vulnerable people that they target. So they give you challenge one after another, and the final challenge is to complete suicide. So it builds onto that, and that adds on to suicidal cases. And then now, finally, there is what we call, life is challenging. Eh? Life is challenging for everybody. Nobody has a perfect life. But social media, nobody posts the downside of social media. Everybody posts the good days or the perfect days. So it's very easy for a person who feels like they've not made it to look at what people are posting and create this illusion that these people have a perfect life and I don't. And this illusion, that comparison, can make somebody feel like I'm a failure, feelings of, what have I done, what am I doing? And this can lead to feeling of, it can lead sometimes to depression, Now, there was an article that was published in the Journal of Social and Clinical Psychology. This was in November 2018. And what they found is that increased use of social media is linked to increased feelings of loneliness and depression. And that that study, strongly suggested to limit social media use to 30 minutes every day. When you limit 30 minutes, it significantly improves a person's well-being. So yes, social media plays a big role when it comes to increasing rates of suicide out there.
I think, Doctor, I agree with you. I see so many of my friends only posting the wow part, and very few posting the negative part. And I think this is something that really hits home for so many people, and they're not really talking about it.
Yeah, Anthony, I think I would like to add to what and emphasize what Wafiyyah said. Social media is a double-edged sword in the sense that it has increased connectivity, but it also helps to spread both the positive and the negative aspects of our lives. For instance, now, what we are doing right now, we're using social media to create awareness of suicide prevention. But at the same time, as Wafiyyah has alluded to, it can be used for negative things in terms of grooming people and spreading negative people to vulnerable people. In fact, there's something in the in the world of psychology we call the Wafiyyah effect. What happens is social media creates personalities. We all have these celebrities who are being followed on social media, but unfortunately they are human beings. So some of them suffer from mental illness and may commit suicide. So what happens there is their fans, as they are grieving the loss of the celebrity, they become vulnerable, and they are known to, especially if there is irresponsible media, reporting, where the media now talks about and describes in detail how the celebrity committed suicide. The fans, as they are grieving, unfortunately, it is known that they will attempt to commit suicide in the same fashion as the person they follow. Okay, it's a known phenomenon which has been there since time immemorial, and it's still there today. So that is how social media and media contribute in both a negative way and also a positive way. Yes.
Talking about that and me being an Arsenal fan.
Yes. I'm happy you said that, because there's a footballer, I think it's called Enke or something, I don't know if you know him. He committed suicide, and unfortunately, as soon as he did that, many of his, there was an increase, a spike, because at that time, the responsible journalism was not taking place. So they noticed there was a spike in the number of his fans who copied him. So, yeah, what you're saying is, it's true. Yes.
I also remember when I was quite young, there's a concert we attended of a musician, and then there was this kid who was denied permission by her parents to go to that concert, and she ended up killing herself. Media truly does play a very huge role.
Yes, true.
Completely. So, what do you think? The people who attempt suicide, do they do it to get sympathy?
No. If threatening suicide is a cry for help, full stop. We never take it lightly, or even if somebody says it as a form of a joke or just a passing by comment, that is a cry for help. It's better that you take it seriously, because you never know when somebody will actually go ahead and do it, rather than saying, this one is seeking attention or whatever it is. Always play it on the safe side. listen to them and allow them to get help. Take them to get professional help. But we never see it as it's just attention seeking or just doing it to get sympathy. Threatening suicide is always a cry for help. Even if it's just a subtle cry, but it's always a subtle cry for help.
Yes, sorry. Maybe I can also add something to that. It is a known fact that, when someone threatens suicide or even attempts suicide in the past, this is normally a strong indicator that in the future they will actually commit it. So we take each, and I'm emphasizing what Wafiyyah said, each and every threat is taken seriously, and it might actually be the threat which they will actually carry out to the end. So please do not dismiss such people. Don't get tired of them. It's not an attempt to look for sympathy. So thank you, Wafiyyah. That's a good point. Yes.
I love that point about getting tired, because there's so many instances where people have tried and actually do get tired. I don't know if you guys can just talk briefly about that.
Yes. So, as I said in the beginning, for those who are joining us now, suicide is basically a complication. That is how we understand suicide. We don't look at it as a disease. We don't look at it as an accident. It's a complication of mental illness in which societal factors have a big role to play. So, someone can, for instance, be depressed and, the medicine is not working or it's working. So they will keep on going down that road of attempting suicide. They get help, they get medicine, then for some reason or another they don't comply with medicine, and then they get back depressed. So that is their cycle, and that's an experience in my line of working. Yes.
If I may also add, there's some people, again, let's think about what's going on right now in the world economically. With the pandemic, people have lost jobs, the economy, things are not right. People are in deep financial crisis. So there are problems that may go undetected. And some people may not seek help for their problems. Some people may not afford it. Some people may think that this is just a phase of life that I'm going through. So some of these mental health issues that Dr. is talking about may go undetected. And when somebody has reached the end of the rope, literally, so to speak, they feel maybe I'm better off not being in this world, and they take their life. Yeah, so we are going through hard times, and people need to come forward and ask for help if they think that it's just too much.
It's interesting that you say that with the African culture of men not crying, men have to be tough, men basically don't show our emotions. What do you have to say about that, Sam?
I don't even think it's an African culture, because
is it?
No, it isn't, because I was reading about it recently, and this is what they call machismo. Machismo is even I think, is it pronounced machismo? I don't know. It's an Italian word. So it looks like it comes in all languages. For example, I was reading about in Canada, they're using social media to reach out to men, because they realize that a lot of men are committing suicide. So they're using the social media to reach out to men to tell them that it is okay to ask for help. It is okay for men to cry. So what is happening is that the traditional stereotypes, gender stereotypes, are telling men should not seek for emotional help, men should not cry, men should be strong. So I think it's the world over that men are being told, you have to be tough. So I think it's all over. And women can cry.
Because I look at myself when I was growing up, and when I was cried, I used to be, just given a very polite slap and told, men don't cry.
Yes.
So this tends to tell men, bottle up your emotions and don't talk. So the key word is it's okay for men to cry.
I think they're also saying that men should wear pink. Real men wear pink.
Very nice. So the situations where you see somebody's getting better, and you feel that this person is actually getting better, then boom, they commit suicide. How do you guys handle that?
So you see what happens. Sometimes somebody might be having suicidal thoughts, but they don't have the energy to go through with it. But they have the suicidal thoughts. So sometimes what happens is when they get that energy, they feel they have the energy, but the feelings of hopelessness are still in them. And what happens is this is the part where they have the energy to go ahead and carry it out. Another reason could also be, nobody actually wants to end their life. Somebody who is suicidal is because they're in great distress and pain, and what they want is to end the pain they're in, not really end their life. So sometimes what happens is a person can give in to these feelings of hopelessness, and that creates it lifts the anxiety that they feel, because they feel like I found a solution to my problems. My distress is coming to an end. And because of that, you find that they appear calm, but in actual sense that those thoughts to go ahead and commit suicide are still there. So the best thing to do is, if you know somebody who was threatening suicide or who was suicidal, and you find that they've gone calm, don't just assume that the suicidal thoughts have disappeared. Go ahead and ask them. Ask them if they're doing okay. Ask them directly if these thoughts are still there with them. Because in those instances, they will appear calm and it looks like they're okay now, but in actual sense, it's just because they feel I found a solution to my problems.
All right. Well explained. Still going back to the issue of men. Why do we see more men committing suicide?
That's the gender paradox of suicide. There are a lot of statistics on that. They say that more women are more likely to experience suicidal thoughts, but men are more likely to take their own lives. That's one thing. So women are 3 times more likely to attempt suicide, but men are 2 to 4 times more likely to die by suicide. So what are they saying is that although women attempt suicide more than men are more likely to complete it or to die from it. And the reason is that men are more likely to use more lethal means of killing themselves or of committing suicide. They use more lethal means. So that's one thing. But one thing to note is that both men and women who have history of prior suicide attempts are at a high risk of future, like what Dr. is saying, at a high risk of future suicide, at a high risk of committing suicide. However, the reasons why men are at a greater risk of death by suicide is that they use more lethal means. And another thing is that, these traditional gender roles is that they discourage emotional expression of men. They are told to be tough and not ask for help. So depression tends to be underdiagnosed in men. They often do not disclose their feelings of depression, and some of them will mask their feelings of depression and call them stress, rather than saying, I feel depressed, I feel low, I'm feeling hopeless, I feel helpless, and I don't, they will not talk about their depressed feelings. And then again, more men are likely to self-treat their symptoms of mental illness with alcohol and substances and other substances. So again, those are, like Dr. talked about, the substance use disorders are more likely, those are people who are more likely to commit complete suicide. So I think very high in the list is that men use more lethal means of completing suicide. Yeah.
Very interesting.
Compared to women.
Very, 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 very interesting. So if I may ask, what are the signs that show that someone is suicidal?
The signs that some, like as Dr. Kevin had mentioned earlier, 90% of the reasons, the 90% of people, the people who commit suicide, 90% of them is because of mental health reasons. And then the other 10 are other reasons, right? But some of the signs that we need to look out for is when you hear somebody talking about dying or wanting to die. Yeah. They say that maybe this world is a better place without me. Yeah. When you hear them talking about feeling empty, feeling hopeless, and having no way out of their problems. I don't know how I'll get out of this problem that I have. I don't see what there is to live for in this world. And then the people, again, some of them, these are all like symptoms of depression, I have strong feelings of guilt or shame. This has happened and I'm very much ashamed of myself. I don't know how I'll get out of this. And then not talking about, you hear them talking about not having a reason to live, or that the world will be a better place without them. People who become withdrawn socially, they don't want suddenly they don't want to be with anyone, they don't want to see anyone. When you see people starting to give away their personal prized possessions, or wrapping up their loose ends, maybe putting things in order, starting to write their wills, just making things, making sure that everything, this is my account, these are my possessions, just making sure that everything is, so that tying up all these loose ends so that when they go, people will not be troubled, yeah? Saying goodbye to friends and family, I've just come to say goodbye to you. And then, again, there are some unusual changes in behavior. As maybe somebody was usually a kind person, very calm, then they suddenly become very aggressive. You don't understand why there are these changes. And then some other behaviors that you may not have noticed, but you may miss out, are changes in sleeping patterns, because suicidal people tend to be, maybe they're very, very sleepy, struggling to get out of bed, or having insomnia. Some of them will start accessing lethal means, e.g., looking for medications, looking for, maybe asking, can you buy me this pesticide or whatever it is. Being emotionally detached from life, keeping an emotional distance, not really caring what is going on around them. I don't know whether there are any more.
Yes, so maybe I can also chip in. Mine is really to help the viewers and the listeners to get a broader perspective. There are many reasons why, and fortunately or unfortunately, we cannot read each other's minds. So there are many reasons why someone will try to commit suicide. So I want to give an example. For instance, let's say I'm a schizophrenic patient and I'm off my medication. Having mental illness already increases the chances that I'll commit suicide. So you as the carer, what you are supposed to do is to make sure that this person is taking their medication the way they should, and the proper follow-up. So that is the roundabout way I would like to answer it, that there are many reasons why someone commits suicide, and Salma has tried to list some of them, but let us take it from a broader view. You might be looking for those signs, but the signs the person you care for is going to commit suicide is something else, and that's a safe way to go about it. Thank you.
Very, very interesting discussion we are having today. We'd like to encourage the audience to ask as many questions as possible, and our panelists will answer them during the session. So, in regards to the signs, Jebras LG has asked a very, very important question. How can you help someone who keeps on uttering and showing, keeps on uttering suicidal words and keeps on showing the signs of suicide?
So first thing first, they keep saying it, do not take what he's saying lightly. Sit with them, give them a listening ear without judgment. No stigma, no judgment. So allow them to speak out, find out what is going on, and don't stigmatize them, and then try to encourage them to seek professional help. Even if it means going with them there, because support can go a very long way. So going with them there, and don't ever promise the person that even if you tell me I will keep quiet, even if you tell me that you're suicidal, I will keep quiet, because you're not really helping them. Tell them it's okay to speak out, encourage them to seek help, but make sure that you do not judge them, because the minute you show any signs of judging them, they will close off and withdraw.
Okay. So let's allow our panelists some few minutes to drink some water. We'll take a short break, and then we will start the question and answer session, and we encourage the panelists to ask as many questions as possible regarding the topic. We'll be back in 3 minutes. Thank you.
Jina langu naitwa Saida Hamid Salim, ni mkazi wa Mwandoni Kisauni huko. Nimekuja hapa baada ya shida moyo, nilianza na pumzi kuniendea mbio. Kaja hapa nikamwona Dr. Swale kwake clinic, akaniwekea mwanzo ya echo, akasema niko na valve moja imeziba. Alafu nikaomba msaada kwa Dr. kwa NHF, kwa ile kitu ile. Check moyo, akaniambia niko na pipe imeziba. Sasa kabidi tuombe msaada kwa NHF tena mara ya pili, kwenda kufanya operation Aga Khan Nairobi Hospital. Sasa ndio nimekuja hapa kwa cheki kidogo. After 5 sijaliwa, naondoka Mombasa naenda Nairobi kwa ajili hiyo ya kufanya operation katika Nairobi Aga Khan Hospital. Inshallah kwa majaliwa yake Mwenyezi Mungu.
Hello, welcome to the Aga Khan Hospital, Mombasa. Today, I'll be taking you on a short journey of our hospital to give you an insight into our COVID preparedness plan to see how you can be safe while you visit our hospital. My name is Dr. Irfan Samji, and I'm the Quality and Patient Safety Physician and the Infection Control Liaison at the hospital. When you arrive at the hospital, your first point of contact will be with our very able security team. These individuals will walk you through a hand hygiene process that will keep you even safer as you come into the hospital. Remember, clean hands are safe hands. Your next point of contact will be at our central triage point. As you walk into the hospital, you will find a structure that we have put up where we have some dedicated nurses who will check your vitals, including your temperature, your blood pressure, among other things, but also ask you about history of travel or contact with anybody who may have symptoms of COVID to be able to identify your next point through the facility. Once you have been screened by our nurses, they will be able to determine whether you may be a COVID patient or not. In the event that you don't fit a case definition for COVID-19, you will be free to continue with your journey through the facility. This means that you will be able to proceed either to see your doctor or to collect medication from the pharmacy or to continue with any blood work that you may have come for.
We are basically ongoing. Our activities are not hindered by the COVID-19 infection. However, we are taking extra precautions. Our medical staff are donned, just like I am, with full PPE kits. We are also adopting social distancing. Our patients are distanced at the reception. Okay,
so we are back on, and I consider this to be the question and answer session. You can ask as many questions as you like, and they'll be answered during the session. So, Asha has asked, how do we handle cases of children who think about suicide while they are very young, and how can you tell the signs? Over to the panel. Let me repeat the question. How do we handle cases of children who think about suicide while they are very young, and how can you tell the signs?
So in the same way, because even children, they can get professional help. So in the same way that you'd handle for adults, listen to them, hear them out, and take them to get professional help. Hear them out, talk to them, find out what is going on, and allow them, or rather than allow them, take them to get help, because there are, I can say that there are specialists as well for children. So it's okay. It's okay for them to also get professional help. And the signs would be more or less the same that you would see, like them now saying continuously. That is also a sign. And some of the signs that have been mentioned by Salma could be the same signs that you notice.
Maybe I can chip in there also. As I said, there are many reasons and there are many different types of mental health issues. And for instance, the child can be having depression, but they could be also having a personality disorder. Like for instance, Anthony, during the beginning, you talked about this child who was promised to go to the concert and she didn't go to the concert and she ended up taking her life. So technically speaking, she probably had everything going for her. She had everything to, a good family, a good education, she had no reason not to take her life. But maybe she had, I can't speculate what she had because I never treated her, but there are cases where children have, for instance, histrionic personalities or borderline personality disorders. And when this person was told they can't go to the concert, to them the shame of going back to school and seeing your friends that, you told them that you're going to be attending a concert and they didn't see you there. So rather than face that, you opted to take your life. So yes, some signs can be picked up, but the most important emphasis here is that when someone threatens it, take it seriously. Because when you take it seriously, you take them to a mental health expert, be it a psychiatrist or a psychotherapist. The mental health expert now delves deeper into the person and picks up the disorder, because for me to try and make the audience psychiatrists and psychotherapists will be very unfair. Let the mental health expert do that job. Let them pick up what is the condition that the person has that led them to threaten suicide. Then we are the ones who treat the condition. Okay? So that is the best way I think I would rather answer it than trying to, yes, it's important some of the symptoms that have been mentioned, but for you as a person, as a parent, as a friend, that threat of suicide is really the only symptom I think you should pick up, take them to the mental health expert, let the person do their job and pick up what is driving the person to utter those threats. Thank you.
Okay. Icon also has asked, good morning. I feel you need to go deeper into clarifying the roles of 1, society, 2, family, 3, the government, and statistics aside, where are we going as far as mental health is concerned, starting in Mombasa?
All right, I can partially answer that question because I think I kind of talked about it. So when I answered the question at first, I said 90% of the cases are due to mental illness, 10% are due to society reasons. Now, how can society play a role? For instance, let's take an example. There's people called suicide bombers. Okay, they are radical. They have radical religious beliefs. So society, the imams, the church leaders, they can preach a more tolerant, moderate form of religion. So that is how society is coming in through, for instance, what we call public education. What we are doing now, social media. We are making the world aware of, suicide can be prevented. So society, in that way, the media is playing a role. You as an individual, you are aware today, you've heard what we've said. So you know that when your friend threatens suicide, if they have any other mental illness, you're supportive. You've already been told, for instance, if someone threatens suicide, do not leave them alone. So you, as an individual, you're already playing your part. There's a part where, might be beyond you, and that's when our government policies come in. For instance, they restrict firearms, you have to have a psychiatric assessment before you receive a gun. So you see, this is being handled at different levels. When someone has attempted suicide, they come to the hospital. The mental wellness team, the psychotherapists, the doctors, and everyone else, before we discharge them, we have an interview with them. So, this is a more directed kind of intervention towards preventing suicide. As far as Mombasa is concerned, where are we heading? I will not answer that because I'm a bit new in town. I'm a bit new in town. I can talk that here in Aga Khan, we are already here. You can see the 2 psychologists, you can see myself. We are setting up our way of handling it, but I don't know what the other panelists think about what is Mombasa doing. What is Mombasa doing?
I'm not sure. Yeah. I don't know, but I do know that at a family level, I mean, some of these psychoeducation, like this session here, we're expecting that parents are watching it, and so it is something that this is a form of psychoeducation, and people can now be more aware and pass on such messages. And I think even media, like I think yesterday there was something on television, there were some interviews where there were religious leaders who were talking. There was a panel of religious leaders who were talking about how people should empathize with people who commit suicide. So I think there are concerted efforts at different levels by different players to bring awareness about suicide prevention. Yeah.
All right. Because last, there was an incident that a student wanted to perform abortion and was stopped by the parents and then ended up committing suicide. What can be done to such a case? Over to the panelists. Yeah.
Okay, maybe I will jump in as Wafiyyah is coming in, is thinking about it. One, to be fair to the patient who, though deceased, did she complete suicide or she attempted?
She completed.
Good, yeah, so to be fair to the deceased, we were not attending to her, so we can't give you the exact reasons why. We'll just be speculating, that is not the best way, I think, to answer that question. But it comes down to the supportive structure which society gives people who attempt to commit suicide. All right, to attempt abortions. That's where now government policy comes in. She wanted to abort. Again, now the religious leaders comes in with their opinion. The laws come in. So they are the ones who deliberate whether abortion should be legal or not. So that that's now the society kind of part. Yeah. So I think we can only limit ourselves to the medical part in terms of what could have been done. And in that case, she tried to abort. She should have, now, apart from receiving medical attention, she should have come to the attention of a psychotherapist because of what she wanted to do. And then maybe something could have been picked up, as opposed to now speculating why and what she attempted and why. Yes.
Well answered, Dr. Kevin. Rose was asked, for those who utter suicidal words, it's a cry for help. What about those who close themselves and never speak out nor seek for help? How can we help them?
Okay, so that's a very good question, because sometimes somebody will not actually say, but to echo what Salma had said before, a change in the person's behavior, subtle changes. So this person has withdrawn themselves, and you might notice that they're not okay, because sometimes the close people, the loved ones of a person are the ones who will be able to notice the changes in another person. So at that point, reach out to them. That's the best you can do. Reach out to them and let them know that you are there to support them, and they have the help is there. You know, like I said before, somebody who threatens suicide or somebody who is suicidal, nobody wants to end the pain they're in or the distress they're in. So a lot of times when you do reach out and show them I'm here for you, there are high chances that they will be appreciative and answer to that. So that's the best you can do. Reach out and let them know that help is there and you're there to support them and keep encouraging them. Don't give up. I think this question was asked before, that don't give up. Just keep showing them that you're there for them.
So I think Wafiyyah, you answered the question that has been asked by class. What's the major help for a person who keeps on uttering suicidal words? So I guess, as you say, just the major help is to reach out to them.
And get them professional help. Encourage them to seek professional help, because they do need help.
Yes, and also maybe just to add in for practical purposes, sometimes for many reasons, be it financial and whatnot, you might not be able to get professional help. But you as an individual being there for them, that's very important, that they know that they're not alone. And, when they threaten suicide, be there with them physically. Not just talking. Be there with them so that you slowly guide them back to the way, back to having hope in life. Also, some people need, for instance, their pastors. They just want someone to talk to, an outlet. Maybe they feel that they don't trust their family members. Maybe they don't feel, they trust their friends anymore. Now this is where the pastors, the religious leaders, even if maybe counseling is beyond their reach, then talk to someone you trust. And that's how now society helps to prevent suicide. The NGOs, I know quite a number of even hospitals are setting up hotlines, be it for people who have substance use disorders, be it, mental issues. These are all, small, these are all factors which are working towards the same goal. We are all working towards the same goal, meaning that we want to allow someone who's in distress to reach out at the comfort, at their own comfort, and when they feel they're safe and free. Thank you.
Thank you, Doc. To the class was asked, at times we disagree in our homes. I always cry, and emotions overwhelms me to a point that I feel something pressing my throat and think of overdosing myself with drugs. But I get an inner voice talking to me not to do it, but another tries to push me. How can I be helped?
It's a good question. It's a very good question.
I think that's a very good question. And what the question is just really echoing what we've been saying all along. If you can get professional help, we can now, that is the step in the right way forward. We need to make a diagnosis. We need to know what is going on. When you say voices, to one mental health expert, that might mean you have a certain disorder. When you say voices to another mental health expert, it might mean something else. So you need to first, if there is any diagnosis which needs to be made, let it be made. Then from there, we now work with you towards a solution. So that is what I would suggest. I don't know if anyone thinks otherwise. Yeah.
They come to help you.
Okay, so with that, we encourage you to reach out to our panelists, and we'll reach out to you and tell you how to get in touch with them. So, sorry, I know it's about 1 minute past 10, so allow us to steal about 5 more minutes or 10 more minutes of your time. There's a question that has been asked. With the current COVID-19 situation and the loss of jobs, this leads to loss of jobs again, retirement, retrenchment, etc. So what role does HR have to play when it comes to counseling? Because most people who lose their job tend to turn suicidal. What's the take on the panel? Please advise.
God, I seem to be hogging on the airtime. Well, HR plays a very important role. In advanced societies, there's usually some form of counseling which goes into this. If you've been terminated from your job, there's sometimes a company counselor or something like that. And even if there's none, now this boils down to the HR. They kind of walk you through it. They're gentle about it. And, so HR plays a big role because you are kind of the employer. So you, how you handle your staff, how you deliver the information that the company they love so much and have worked for so tirelessly, for many years, is about to leave them. You play a big role in preparing them for that next stage. And with COVID, companies have to now downsize, and that's it. So that's the economics of it. So in that aspect, I think HR is about preparing your people well and setting up appropriate channels. Even if they are no longer with you, you kind of refer them to help. You see, this is where we have a problem, and this is where the HR will play a role. Giving someone direction, you tell them, okay, fine, this job is over. As you're waiting, should you need help, this is where you can find it. In your own way, you've done your part. And let, the rest flow from there.
Okay. Fantastic. Someone has said, please carry my ID. I have some burning, humiliating, embarrassing issues that are causing suicidal thoughts. There is a rumor that has been spreading about my sexual life. I released a certain girl from my room, which is poor hygiene. As a health professional, I advised her how to clean herself accordingly. Unfortunately, she decided to go make up stories about me. The rumor has made me the talk of the town, and I am depressed. Nevertheless, I'm 31 years old. Those who received the rumor laughed sarcastically and talk humiliating jokes at me. It kills me, especially with this joblessness. I have a lot to say. I need your answers. I am so depressed. Over to you, Alice.
I think, yeah, my heart goes out to him, and I think he's a very brave person to write that, and he needs, if he is able to, he needs to come forward and seek professional help. He should come and see a professional health worker to walk him through what he has gone through, yeah, and maybe go for further assessment and see whether he needs to be referred to a psychiatrist or he can go through therapy to manage his feelings, because it is not good. You know, when people spread rumors about you, it can be a very difficult thing to manage. Yeah, because when your reputation is damaged, especially something so sensitive, it can be very humiliating.
All right. Dr. Kevin, how do you get in touch with you?
Well, I'm currently running a few sessional clinics or clinics here at the Aga Khan Hospital, the main hospital, and hopefully you can book an appointment. I think it's on the website. I think also if you are in any branch of Aga Khan in Coast Region, they know how to book an appointment with us. Hopefully we'll be expanding my clinics to other areas, but that's in the future. But for now, let's leave it that contact Aga Khan Hospital and they will book an appointment with me if necessary. Thank you.
So, Mike, we want to get in touch with you.
Thank you.
I know you've just joined us.
Thank you, Anthony. Yeah, I will be soon starting at Nyali Clinic. I'll be going there on Tuesday mornings, but I haven't yet started. The process of registration. There are quite a number of processes I have to go through.
Okay.
So in the near future, I should be there. But I think that if somebody were to contact the Nyali Clinic, they should be told when I will be starting.
Okay.
Yes.
Thank you.
For me, I am here every Monday and Wednesday from 9 a.m. to around 4 p.m. On Thursday morning, I'm at Aga Khan, the Kuze branch, from again 9 to 12 p.m. to 12 noon, and then I'm here from 2 to 4 p.m. Fridays, I'm also here from 9 a.m. to around 2 p.m. depending on depending on the patients. And I'm also here on Saturday if need be. So if somebody cannot come, because I understand some people work, if somebody cannot come over the weekdays, but they need to let me know in advance. So to book with the hospital in advance so that I know this Saturday I'm coming in.
Right.
The only day I'm not here is on Tuesday.
Okay.
Yes.
So to our audience, just to let you know that here means Aga Khan Hospital, Mombasa. So that's where you can get Wafiyyah. So to our audience, thank you for joining us. We know we've taken about 8 more minutes of your time. We'd also like to thank the panelists for taking time off their busy schedule to talk about suicide. I believe we'll be having a discount next week. I don't know if you guys want to mention about that. Yeah.
So because of Suicide Prevention Day, Aga Khan is offering 20% off the charges at the mental wellness clinic. So that includes all psychiatric and psychological services, 20% off. So please make the most of it. That is from Monday to Saturday next week. Please come in.
All right. Thank you very much. Rose, many thanks for the session. Very helpful and informative. Faith, a very informative session in time. And from me, Anthony, I say thank you very much for coming. For audience, 2 weeks from now, we'll be having another Facebook Live session, and we hope we'll be talking about cardiology, but we will confirm to you during the course of the week. Thank you for joining us. Thank you for your questions. See you in 2 weeks' time. Thank you very much.
Jina langu naitwa Saida Hamid Salim, ni mkazi wa Mwandoni Kisauni huko. Nimekuja hapa baada ya shida moyo, nilianza na pumzi kuniendea mbio. Kaja hapa nikamwona Dr. Swale kwake clinic. Akaniwekea mwanzo echo, akasema niko na valve moja imeziba. Alafu nikaomba msaada kwa Dr. kwa NHF, kwa ile kitu ile. Check moyo, akaniambia niko na pipe imeziba. Sasa kabidi tuombe msaada kwa NHF tena mara ya pili. Kwenda kufanya operation Aga Khan Nairobi Hospital. Sasa ndio nimekuja hapa kwa cheki kidogo. After 5 sijaliwa. Naondoka Mombasa naenda Nairobi kwa ajili hiyo ya kufanya operation katika Nairobi Aga Khan Hospital. Inshallah kwa majaliwa yake Mwenyezi Mungu.
Welcome to the Aga Khan Hospital Mombasa's Physical Medicine and Rehabilitation Center, a unique building of its kind. This is the only facility which provides an integrative combination of physical, occupational, and speech therapies.
This is the only facility where we'll find niche services like cardiac rehabilitation, neuro rehabilitation, speech therapy, aquatics therapy, and sensory integration.
Here at the PMRC Aquatics Therapy Pool, we're able to manage orthopedic, cardiovascular, and neuromuscular conditions. We'll provide you with top-notch training to bring you improved agility, mobility, stretching, strengthening, and coordination. Come and join us here at the Aquatics Therapy Pool and get aqua fit.
In PMRC Aga Khan Hospital Mombasa, we are providing speech-language therapy services for the adults and children population. For adults, we are providing speech therapy services for patients with communication difficulties as well as with swallowing difficulties. For children as well, we are providing services with communication difficulties, stuttering, voice difficulties, and many more.
We are able to provide top quality occupational therapy services for both pediatric and adult patients. Our services include sensory integration, hand therapy and splinting, activities of daily living training, and we also deal with patients with neurological conditions.
We do neuro rehabilitation for patients with paralysis of upper limbs and lower limbs or one-sided paralysis. These are patients like stroke patients, MS patients, Parkinsonism, and we assess and do a thorough and comprehensive evaluation to make a plan that will befit their physical needs.
For cardiac rehabilitation, we see patients before they have had an event or after they have had an event and they have gone through the cath lab. We do exercises monitoring their blood pressure, their ECG, their heart rate to see how much their heart is performing during the exercise program.
We do spinal mobilization for the neck, back and other joints to ease your pain. So let's all welcome here, take away your pain.
As you can see, we provide a unique combination of therapies. You're welcome to come and join us, work with our top quality physical, occupational, and speech therapists, as well as our physicians attached to the Aga Khan Hospital in Mombasa. With or without a referral, we'll be happy to bring you back to your optimal condition.
For any queries or to book an appointment, kindly call the numbers appearing on the screen. We are located at Mbuyuni Road, near MN Cafe, right opposite YMCA.